And systems thinking allows us to do that because we can think about what are the intended consequences I want to create from my actions. Who else do I need to bring to the table? What assumptions am I making about this situation? And are my assumptions correct, or do I need to get a little bit more information?
This is a podcast called Walk, Talk, Listen. An attempt to connect people and make this world a bit better by sharing opinions and experiences based on the belief that everyone's perspective is true, albeit partial. My name is Maurice Blom, and I would like to welcome you to yet another episode of Walk, Talk, Listen. Good day, everybody. This is another episode of the podcast Walk, Talk, Listen. And as always, I'm delighted with today's guest. Yes, Angie, please introduce yourself.
Yes, well, thank you for the gracious invitation to join you today. My name is Angie Tagtow. I am the founder and chief strategist of Äkta Strategies and based here in central Iowa.
And were you born and raised in there as well?
Upper Midwest, yes. I grew up in central Wisconsin, and just to give everyone a little bit of geography sense, I grew up in rural central Wisconsin, somewhat on the edge of the Driftless region in Monroe County, Wisconsin. And at that time, in the 70s and 80s, surrounded by lots of dairy farms and cranberry bogs, and also tribal land from the Ho-Chunk Nation. So grew up in central Iowa, very rural part of the state. Mm-hmm.
So did you grow up farming as well, helping out, or
not farming, but definitely in a rural area? And
okay, you did.
Being a child of the 70s and 80s, we were always outside. We had large garden. Food preservation was a priority for my family. And at that time, I grew up in the shadows of a VA medical center. My dad started his career as an Army medic in the early 1960s, and he then continued to pursue a profession in medicine and became the first physician assistant to work at the VA Medical Center in Tomah, Wisconsin. And he eventually became chief of ambulatory care at the VA in Tomah. And I really think that highly influenced my career path as well in nutrition and public health.
Yeah. And is there maybe a moment then when you grew up where you thought, oh, this is what I want to do when I grow up? Or was it more of a process?
Definitely a journey, definitely a process. Yes. My mom also worked with the public school district for many years. Mm-hmm. So I think with my dad in his federal service capacity and my mom in the public school capacity probably influenced my perspective on, public service. As well as the health sector, and of course, growing up in a rural area, my affinity for being in nature. And so I think that definitely, the combination of those elements definitely influenced what I've done over my career and where I am today.
Before we go, asking you what do you do now? You decided to, tell us a bit in terms of, how did your choice come about? Oh, this is what I'm going to study, and and then where, and
right,
how that might have influenced what you're doing.
Right.
Now.
Well, I was fortunate enough to get a scholarship to the University of Northern Iowa, and I originally intended on doing an undergrad to get me prepared for College of Medicine. And midway in that academic endeavor, I came across the degree in dietetics. And at the time, I wasn't as familiar as to what that was all about. But I really had an inclination to work in maintaining the health of people, not necessarily treating diseases and things like that, but really how can I best help people stay healthy? And so I transferred over into the degree in dietetics and finished that degree along with a degree in chemistry. And that academic trajectory then went into a degree in food science, human nutrition, and family and consumer sciences education, and most recently a doctorate in public health with a focus on leadership. And so over the course of the last 30 to 35 years, I've also had an opportunity to do several fellowships.
Mm-hmm.
And those fellowships were in sustainable agriculture, they were in food and nutrition policy, and in public health and public health leadership. So a rather unique combination of academic training, but it has allowed me to be able to work at that nexus of nutrition, food systems, and public health. And that trajectory has taken me into some pretty interesting spaces. As a public health practitioner and as a registered dietitian, I really have been focusing my work on advancing nutrition, not only at an individual intervention level, but how do we create policy, system, and environmental changes that really can advance population health, community health, population health, a much broader perspective of public health. And I would say most of my career, and even today, I continue to work with or in the public sector. I have worked with municipal and county public health agencies. I have worked with and in state and federal agencies. I've worked at an international level with the World Health Organization and FAO, the Food and Agriculture Organization, and have worked with many nonprofits and non-government organizations. Today, I have a consulting firm, Äkta Strategies, and that consulting firm really is looking at how do we build the capacity of leadership? How do we build the capacity of teams and organizations to advance these different levers of policy, system, and environmental change to improve population health? And today, I really classify my work falling within systems-based practice and with a specific focus on systems thinking as well as structural empowerment.
And it's really fascinating, I think. And I read a couple of your articles and have some questions around that, especially later, because I also always ask questions around sustainable development goals and inner development goals as well. But before we go there, Angie, I would like to ask you, because you said, you worked on policy and why it's important. You did work for the government. Can you tell a bit about how did you get there, and what is maybe something that you're proud about that happened while you were leading it, because you were the executive director, right? Even of
that was one foray in working in government. My first foray actually was my first professional position with the Iowa Department of Public Health. I came in as a nutrition consultant, and I worked with the WIC program, the Special Supplemental Nutrition Program for women, infants, and children. And so state government was really my first foray. But in 2014, I was invited to join the administration as the executive director for the Center for Nutrition Policy and Promotion at USDA. And I came in at a time which was rather interesting for not only USDA, but for the Center for Nutrition Policy and Promotion as well. I was coming in at the end of a review process for updating the dietary guidelines for Americans. And during that revision process, the scientific committee that was in place had been looking at the element of sustainability when it came to dietary patterns. And so it was the first systematic review of the literature to look at the connection, the interconnections between elements or ingredients of sustainability and dietary patterns, both current dietary patterns in the US, as well as what we would constitute a healthy dietary pattern per the dietary guidelines. And so that advent of introducing sustainability in the dietary guidelines really was a fascinating time within USDA and our partner, the U.S. Department of Health and Human Services. It was the first examination of sustainability at that time. To fast forward to 2015, 2016, needless to say, sustainability was not it was a popular topic, but it was not well embraced and well regarded by members of Congress and, of course, by many of our members in the food sector. And so, for political purposes, the issue of sustainability did not appear in the 2015-2020 dietary guidelines for Americans. Which is really unfortunate because now we have seen worldwide many countries as they update their national nutrition guidance systems are looking at the different issues and elements of sustainability, and they are incorporating aspects of that into their revised dietary guidance systems. And so in retrospect, now that I can look back almost 9-10 years ago, a missed opportunity for the US to really lead in this space. It was the first systematic review of that literature at that time. And other countries have now utilized that work of the Dietary Guidelines Scientific Committee. And they are able to leverage that and incorporate that element into their own nation's dietary guidance. And so it was definitely the experience at USDA definitely brought many opportunities in which we could make a difference in leveraging things such as the dietary guidelines for Americans in advancing population health in this country. But I think it also put a spotlight on just how politics can influence public health and specifically nutrition policy.
And because we also have listeners from outside of the US. Yeah, do you know why, let's say, the politics were pushing back on sustainability issues? Why is that? Because if you look around the world, and you look at the Sustainable Development Goals, for example, almost in every country where I've been, you see people, and that's not only politicians or people from the government, but also, people at the grassroots in countries like the Netherlands or countries in, Kenya. Because it's something that we have discussed as a world, right? And said that is how we are going. It's not perfect, but that's how we're going to make the world a better place and more sustainable. Why is that pushback then within the US? Although I have to say my learning is kind of, it depends also from which state you are and what is being done. So,
right.
Or am I wrong? Do you have a different view on that?
Well, at that moment in time in which the 2015-2020 dietary guidelines for Americans were being launched, there was a lot of discussion by members of Congress about the role of the dietary guidelines in the US system. And that goes back to what they passed in 1990, which was an act, a bill to instill dietary guidelines for Americans within federal government to inform federal food and nutrition policies and programs. And so that was the original intent of the National Nutrition Monitoring and Related Research Act of 1990, was really to instill a foundation to inform healthy eating across federal food and nutrition programs. And within USDA, at that time, there were 15 food and nutrition assistance programs that were then dependent upon the revision process of the dietary guidelines to ensure that their nutrition guidance and their food programs aligned with the dietary guidelines. over the course of the last 30 to 40 years, the dietary guidelines have seen applicability within other institutions as well, of course, and especially with food and beverage industry and how the dietary guidelines may help, shift the types of products that are available to consumers in this country. There's definitely been a lot more political engagement on the dietary guidelines revision process, and we're seeing that play out today also with some of the elements that have been proposed in the current Farm Bill. And at that time, Congress didn't like the stories that they were hearing by their constituents as to how these sustainability policies may impact their company's bottom lines, so Congress had a lot of conversations with the secretaries of both USDA and HHS at that time, and it was decided that sustainability wasn't the appropriate time to incorporate sustainability into the 2015-2020 dietary guidelines. And so fast forward to today, the role of evaluating the research, the science behind dietary patterns in this country and various elements of sustainability has now been shifted over to the Department of Health and Human Services. And so they are currently working on it. The Office of Nutrition Research is actively working on untangling that web of research to really identify, what is the role of sustainability with healthy eating. I would also, point out, though, that the political conversations around the dietary guidelines continue, and that there are efforts from other groups that are trying to change the dietary guidelines for Americans and or eliminate the dietary guidelines for Americans from the federal agency system.
Yeah, I have the feeling that we could do another podcast or two about that.
Yes.
I would like to jump though to your present company. Yeah, can you tell a bit about, why did you start it, and yeah, you alluded a little bit about what you were trying to do, but yeah, give us a little bit more elaborate
Sure.
elevator speech about it.
Sure. Well, this is actually my second consulting firm that I have launched in my career. My first one was really focused on how do we build greater conversations on that interconnectedness between nutrition, food systems, and public health. And that really got me immersed into a systems-based approach to link our natural environments to the food system, because our nutrition and our access to healthful foods and overall population health are totally dependent upon the food system that we have at our disposal. And so at that time, it was really, how do we connect these different sectors, and to have this conversation about how do we work together to create a much more sustainable, healthy, and resilient food and water system in this country. And then I got the call to join the administration in 2014. And when I came back, I decided that there was a lot more to explore, and to a lot more sectors and individuals and entities to connect into this conversation, and linking these efforts more to a greater population health conversation. And so the focus really is, how do we build the capacity among current leadership, whether that's in the public sector or in the private sector? How do we build better capacity within teams and organizations to identify specific policy, system, and environmental levers that they can then advance to meet their strategic management goals, to make a contribution to building community health, community wealth, vitality, and overall improving population health. And so the focus of Äkta Strategies today is really looking at how do we make authentic approaches to systems change? And how do we build the capacity among not just nutrition and dietetics or public health or food system leaders, but how do we build the capacity collectively to be able to advance policy, system, and environmental change? And so the consulting firm today has much more of a integrated leadership development, coaching, and mentoring aspect to it than the previous consulting version did.
I find it fascinating, and my listeners know this because one of the things I try to do is talk about sustainable development goals during these conversations with my guests, and that is also about process and system changes. So something that you also relate to, and what this growing group of people have discovered is that one of the reasons that we are behind with the sustainable development goals, that we are probably going to hit on average 15% before 2030, is that they say not enough attention is being paid to the knowledge, skills, and abilities that we need as individuals and as communities. So they did a survey, and as a result, they came up with the inner development goals.
Mm-hmm.
5 goals: being, thinking, relating, collaborating, and acting.
Mm-hmm.
So I have 2 questions maybe to you. One is, when you listen to that, these 5 goals, what are your thoughts? And then especially because what you try to do in terms of, searching for system changes, but ensuring then that you need to work on this leadership capacity.
Mm-hmm. Well, first of all, thank you, Maurice, for bringing the inner development goals to my attention, because I was not aware of them prior to our conversation today. And after taking a look at them, I really am quite excited about it, because they definitely resonate with me. And there are elements of the inner development goals that are very closely related to leadership development models. And it really aligns and supports with many of the public health conceptual frameworks that I have used and or developed in the past. And so you're absolutely right. It's one thing to have these awesome set of sustainable development goals, that hopefully countries and regions are subscribing to. But in order to get there, you have to have the mechanisms in place to advance the progress, right?
Mm-hmm.
And so you do have to focus on the capacity at individual levels, at team levels, organizational levels, and even country and regional levels. And I really appreciate this framework because it addresses action. It gives very tangible examples of how we can be very action-oriented and driving progress to those sustainable development goals. The one thing that I would like to add to the inner development goals is, under the thinking part, is critical thinking is, of course, essential to these conversations. Systems thinking is also quintessential to being able to connect the dots, being able to look at how a driver can have both intended and unintended consequences. And so I would just like to put that forward, that I think systems thinking, in addition to critical thinking, would be a very valuable asset to this model.
Right. And I'm planning to go to the 2nd or 3rd conference that will take place in October in Stockholm, Sweden. So I will bring that. But what is interesting is that if you look at the 23 skills that were identified to reach those 5 goals, empathy, critical thinking, as you said, and you're now suggesting to add systems thinking. I spoke 2 weeks ago, I think, with another guest of my podcast, and she said, forgiveness is not there. And I found that also interesting in terms of working on yourself, right? And then moving forward.
Or giving grace.
Yeah, yeah.
Mhm.
Right.
Mhm.
Okay, and I would really like to invite the listeners also to check out, some of your publications, because I do think it's I think it's putting almost the inner development goals into practice when you look
Mhm.
at looking at the personal, at the collective, and then linking that with the system changes that are required. So so if you go to your website, I think you will be able to find the different articles, and so I would like to invite my listeners to check your work out. I would like to go to the next part of the conversation, and as you know, this podcast is a spin-off of my 100-mile walk that I started in 2012, and I'm started to practice again. The next one is in the first week of October. New Jersey, New York. More information soon. But when I am accompanied, not for the whole 20 miles per day, but a mile, or sometimes 5. Very often we start talking about what is the meaning of life, religion, spirituality. And the question that I'm most fascinated with is when we start talking about the youth and how they perceive and experience religion and or spirituality. So the question that I always ask is, what do you see happening among youth in your environment with regard to religion and spirituality? I'm asking because a lot of people saying, oh, they are less spiritual, they don't go to church anymore. Well, it depends where you are, Western countries or Southern countries or East, West Coast, Midwest. So what do you see happening?
Yeah, this is a really great question, Maurice. And I always approach religion and spirituality differently.
Mhm.
Religion being perhaps a little bit more structured, faith-based. Here in the Midwest, you typically see, the white churches with the really tall peaks. Whereas I see spirituality as being very individually focused and related to one's connectivity, growth, development. So I do see those a little bit differently. And I think I've always aspired to be or to participate in nature-based spirituality. I have learned over the years that I really thrive being in nature. My husband and I moved to the land here in central Iowa over 30 years ago. And at that time, it was row crop production, 1 year in beans, 1 year in corn. And we saw a lot of changes in our environment with that kind of structure on our landscape. And back in the year 2000, we converted our cropland into a reconstructed prairie. And so I think the biggest gift that we gave ourselves, but also our land, was to be able to revive the landscape. And it's been a tremendous learning experience over the course of the last 25 years of watching the transformation that has happened on our land, not only from a plant standpoint, but from a soil standpoint, and even from seeing the different types of birds and other critters around here that weren't here before. And so I think back to the spirituality question, I really thrive being in nature and I find a connection with nature. So I want to just set that as a precursor to what I'm about to say regarding youth. Being a public health practitioner and having followed the work of our current Surgeon General, Vivek Murthy, he's really taken a closer look at the role of mental health of youth and specifically around social media and the mental health of youth. And he's released a couple of reports in the last 2 years about this connection and the challenges that we're having with youth around mental health and that influence of social media. And of course, having now on the back end of a global pandemic, really being able to evaluate that impact of our youth. And that report that he put out within the last year, he identified that youth are spending about more than 3 hours a day on social media, though they face a double the risk of anxiety and depression symptoms. And at that time, the average daily social media use in this age group was like 4 to 5 hours per day. And so he also found in various studies that nearly half of the adolescents say social media makes them feel worse about themselves, about their bodies, and things like that. And the Surgeon General has been quoted saying that if we seize this moment and step up for our children and their families in their moment of need, and lead with inclusion, kindness, and respect, we can lay the foundation for a healthier, more resilient, and more fulfilled nation. Now, does that get at your question about where youth are when it comes to religion and spirituality? I definitely think that this is a major influence on where spirituality and religion are with youth today. I don't have any answers, Maurice, to that questions per se, but I have more questions. And one of them is that what is missing? Are we really investigating what's missing within the lives of youth, and where does spirituality fall? What is happening within the environments that youth are in today that is influencing their embracing a more of a spiritual connection? And I do think that the social media access and use and consumption by youth today is likely influencing their feelings around religion and spirituality. So not perhaps a conclusive response, Maurice, to your question. I do think there are a lot more questions to ask.
No, thank you for that, and also lifting up, the challenges around mental health. And then you have mentioned reconnecting with nature. I mean, that was an important part of your life and your own growth, right? And you did not say this, but maybe that's something that you'd like to encourage, the youth to do as well. Although we see also trends where the younger generation is doing that and much more aware that we should not be thinking only about humanity, but also about the planet. I think that's what I observed so far. I would like to continue on the connection. And what I hope that this podcast is doing is, connect people with people. And then again, you might disagree with what Angie was saying for the last, 30, 40 minutes, but there might be something that you can still connect with. And that could be a start of a conversation or a search for, what is Angie about, what she's doing. So I have also tried to incorporate it in my questions by connecting you not only with the listeners, but connecting you with my guests. So I have a question for you from the previous guest.
Yeah, my question is on how can we best build trust in a world system that is built on control?
Amazing question. Very difficult question. And without sounding too Pollyannish, I think there are some key ingredients in building trust in a world system. And again, that starts at a very individual level. Back to your inner development goals, Maurice, it starts at an individual level. And think of this as concentric circles. I think there needs to be more empathy. I think there needs to be more authenticity, integrity, and empowerment. And when I talk empowerment, I'm not just talking about the psychological empowerment to individuals, but how can we create structures and organizations that enable empowerment of constituents, of consumers, of the public, of communities. And with that, those ingredients are having access to information, having access to opportunities, having access to resources. And I'm not just talking about financial resources, but having access to resources and having access to support. So if you're a member of a team in a government agency or even in a company, when you're empowered with information, opportunities, resources, and support, that team, that organization, that company often thrives. There are definitely advantages and benefits when you empower your employees, your team, your staff by offering them information, opportunities, resources, and support. The same thing can happen when it comes to governments. When governments offer access to information, opportunities, resources, and support to the individuals that live in that country or that county or even that municipal area, that often results in much more stabilized and resilient structures, whether it's at a community level, a county level, or even at a country and national level. And then I would also pepper in to that, Maurice, is communication, relationship building, and active listening. And again, those are principles that come out of the organizational and structural empowerment space, but they can easily be applied to decision makers, policy makers at a regional and even countrywide level. So those would be the ingredients that I would put forward to build better trust in a world system.
A difficult question, but equally a great answer. So thank you for that. My listeners know that I especially resonate with talking about listening, because that's something that hopefully I slowly get better at. But was definitely not good at when I started this podcast. A couple of years ago, 200 episodes ago. Because we are often so occupied with our own questions that we don't, and our own thoughts, that we don't really listen. Your question for the next guest.
I'm struggling with this. Within the public health space, we have a lot of challenges. We have capacity challenges. We have resource challenges. We now have new power dynamics and a loss of authority within public health, and especially within governmental public health. But at the same time, and I think the last 4 years or so is a great case study in misinformation. And I think my question, Maurice, for the next guest would be, what are key strategies in addressing misinformation around health issues? So, my first foray into this, of course, was with diet misinformation. As a registered dietitian, a lot of different diets out there, not necessarily evidence-based approaches to improving health. But we have seen a great deal of perpetuation of misinformation within healthcare systems and in public health systems. And so how can we best mitigate misinformation around health and public health issues?
Great question. I'm looking forward to passing your question on to the next guest. Angie, music is very important to me. So I always have a question about music as well. And the question is, if you had to choose a song or a piece of music that represents for a big part, who you are, which song or piece of music would that be and why?
Yeah, this is another really challenging question for me. I don't put myself in a very specific genre of music, Maurice, and so it all depends on the moment, the mood, and the activity, right?
Mhm.
But I think this morning I even heard it, and it just always resonates with me. Is I really enjoy classical cello music, and the specific piece that really resonates with me every time that I hear it is Yo-Yo Ma's "Nature at Play." It's Bach's Cello Suite Number 1, and he has a really powerful video with that playing that music, and I believe it's in the Great Smoky Mountains. And again, it just resonates with me, the music itself, but the video definitely encapsulates that passion for being in nature as well.
Great. And I love Mary May as well. And you know, the Bach suite that he did. I don't know if we already have that, because for you and the listeners who are not familiar, we made a Spotify playlist of all the songs that were selected by my guests. So if it's not there, we will add yours as well. And you can find it on Spotify, and you search for hashtag Walk Talk Listen, and then you find all the songs that were selected. And that is from country and western, R&B, classical music, hard rock. It's yeah. I when I listen to it, I always have to smile, because it reminds me of the conversations that, yeah, I'm privileged to have had with so many great people. Um, I don't know if this is still going on, but Steve Hartman of CBS did a series of video episodes, examining how one simple act of kindness can create a ripple effect. So I have two questions for you about that. One is, what are your thoughts about the potential of creating a ripple effect, one small act, a simple act of kindness? And the second question is, if I ask you now, to come up with one simple act of kindness that you will do this week, what would it be?
Well, before I answer that, Maurice, there's one thing that has always been a key philosophy in my life, personally and professionally, and that is to live without regrets and never look back and say, I wish I had. And so, because I've applied that philosophy, I've had amazing gifts given to me, because I haven't closed that door. I didn't close that window. And when that door or window was closed, I tried to find a new one to open. And so never looking back and saying, I wish I had. I am currently living out an amazing gift today. A couple of weeks ago, the wife of a mentor reached out to me and asked if I would help facilitate the writing of a Festschrift. And a Festschrift is a German word called celebratory writing, often done in academia, in which someone has completed their career in academia and moving from a full professor to an emeriti, for example, and it's to honor that individual's body of work and their commitment to that body of work and their scholarly endeavors. This individual that I will be coordinating this Festschrift for has been a remarkable influence in my life, and to be asked to be part of creating this collection of writings from his colleagues truly was a gift beholden to me. And we're just starting this process, and to be able to interact, connect, and communicate with his colleagues, who are also luminaries in the area of sustainable agriculture and sustainable food systems. That truly is an amazing opportunity right at my doorstep today.
Right.
I wanted to
Wonderful.
highlight that I didn't perceive that as, oh, this is another responsibility. I got to put it on my plate to do. but truly a gift to be able to assemble this celebratory writing document and hopefully be able to gift it to them, in the next 6 months or so.
Wow, amazing. Well, congratulations, and looking forward to that. Yeah. Yeah, wonderful. Any message, question, or invitation for the listeners from your side?
I guess just circling back on the two topics, Maurice, on systems thinking and structural empowerment. There are a lot of things that we can do as individuals that can leverage those skill sets to make a difference within our families, within our communities, and if you are in public service, for the population at large. And I think one thing that we all can think about is how we respond to events in our life, and taking a moment to reflect and engage in some systematic reflection, and then creating a course for a positive forward. And systems thinking allows us to do that because we can think about what are the intended consequences I want to create from my actions? Who else do I need to bring to the table? What assumptions am I making about this situation? And are my assumptions correct, or do I need to get a little bit more information? But I do think that everyone has the ability to contribute to a more vital, resilient, and stable community. And it may be as simple as volunteering at the public library. It could be, calling the city planning office and asking for curb cuts and sidewalks because there's a veteran down the street who is now in a wheelchair and he needs to get to the grocery store. It's all of these little acts that can really strengthen a community. And having lived in the rural Midwest my entire life, being able to see how communities come together during times of crises is a demonstration of the resilience of rural areas. And so it just takes small acts of kindness and of thoughtfulness, mindfulness, to really build strong communities.
Right. Yeah, I know that you are aware of the National Strategy on Hunger, Nutrition, and Health.
Yes.
Now, my organization, together with other organizations, so CWS, the Alliance to End Hunger, Bread for the World, Interface, Public Health Network, Feeding America, Islamic Relief, USA, and Mason, we came together, we formed a consortium and are trying to make the strategy, the national strategy, more known within the US, because we think that could be an important instrument in trying to end hunger within this country, which comes as a surprise probably for a lot of the listeners, that in this country there are a lot of people that suffer from hunger and don't have the right access to the right nutrition as well and intake. So yeah, what do you have any tips, for this consortium on how it should, continue to spread the word and assist the government? And again, the strategy was approved or endorsed by both parties, so it's a bipartisan initiative, and so that's a great thing. Yeah. What needs to be done from your point of view?
Well, first of all, just to acknowledge the landmark event that the White House hosted, this national focus on hunger, nutrition, and health. First time in 50 years that an administration has really made a concerted focus and commitment to addressing these issues. I have a few thoughts, Maurice, on that. Collaboration is key. And so to hear about this network of organizations coming together to address the proposed strategies and identify communication strategies as well to get the word out, but also making a commitment to addressing hunger, nutrition, and health in this country. That collaboration is key. Within collaborations, you need to have champions and you need to have glue within that collaboration to be able to sustain momentum. And so whatever happens the end of this year and heading into next year, hopefully the momentum behind all of these strategies that are outlined in this National Hunger, Nutrition, and Health Plan will continue. And it will be up to the coalition that you just mentioned to ensure that that happens. So communication, having champions at the table. It sounds like you all are putting forward champions on this effort, and to keep asking questions and to continue to communicate to the different organizations' membership of the importance of that collaborative and moving this work forward. This isn't going to go away at the end of the administration. This is an ongoing effort. One of the activities that I have been involved with throughout my career is here in Iowa addressing access to healthy food for low resource families and communities. That work continues today. And one of the things that I was able to do almost 10 years ago was to assemble a statewide food access and health work group, very similar to the collaborative that you just described, Maurice. And we attracted over 600 individuals and organizations to that statewide effort. The paradox that we have here in the state of Iowa, as in many other Midwest states in which agriculture dominates the landscape, here in Iowa, we dedicate more than 80% of our landscape to agriculture. Yet the paradox is that we still have moderate to sometimes higher rates of food insecurity and hunger in this state. Here it is, a state that grows a tremendous amount of quote unquote food, yet we're not growing the right types of food to be able to support health, especially among our more disadvantaged communities, individuals who live in disadvantaged communities. And so that's a paradox that's not going to go away, even with a change in administration. And so looking at food insecurity and hunger from a household, community, and even population level, using that social determinants of health lens or a determinants of health lens, looking at social elements, looking at even commercial elements and political elements of that determinants of health. And by raising that determinants of health lens within your collective, within your collaboration, will help you with identifying strategies that you could advance together that are really going to make long-term sustainable change.
Thank you, Angie. Yeah, a lot to think about for us. But yeah, the good thing is that we were able to put these people together that are very committed towards this. So that's a good and important start. Before I thank you for the conversation today, any question that I did not ask you, what I should have asked you?
I don't think so. I think we really covered the gamut here today.
Great. Yeah, then I would like to thank you for your willingness to talk with me and share your wisdom and your stories. Yeah, if what is it? Let us repeat again the website that people should check out to find out more about your work.
I would encourage them to go to my LinkedIn profile. Just do a search on Angie Tagtow and you'll find me.
Okay, great. Yeah, thank you so much. And
thank you.
Yeah, and all the best with everything you do.
Thank you very much. My pleasure.
Bye-bye.
Thank you for listening to Walk, Talk, Listen. Please check us out on 100mile.org or follow us on Facebook or Instagram.